Very good. Good afternoon. And so today we want to talk about lung cancer awareness. It's a big problem, and there are things that can certainly be done. So it's probably one of the most important cancer awareness talks that can be given. So we're going to talk about the risks, screening, things that can be done for prevention, and treatment options. So lung cancers are usually grouped in two main types. There is what we call small cell lung cancer and non-small cell lung cancer. And within the non-small lung cancer, there is the adenocarcinoma and the squamous cell carcinoma. So they're called small cell because when the pathologists look at them in the microscope, they look like tiny cells. They look like a bunch of grapes. And then the non-small cell are bigger cells. And they grow differently, they behave differently, they have different biologies. So we approach them and treat them differently with different medications. So about 90% of all lung cancer are the non-small cell lung cancer. Lung cancer may spread to the lymph nodes or other organs in the body, such as the brain. And cancer from other organs also may spread to the lungs. When cancer spread from one organ to another, they call that metastases. So I'll explain myself. So say if you have cancer in the lung, those cells divide quickly, they invade the arteries around the lung, then it breaks the artery, and the cells can then float around the body in the circulatory system and end up in the brain, in the liver. So when a cancer is spread to distant parts in the body, that's what we call a metastasis. Okay, so not everything that it's in the lung, it's a lung cancer. It could be something that started, say, in the colon, in the large intestine, and then it spread, a colon cancer that spread to the lung. So that's important of doing all the testing. So lung cancer is the #1 killer, unfortunately. When we look at these tables, you can see that in 2023, breast cancer, in terms of the new cases, breast cancer had 300,000 in the US. Prostate cancer had about the same, but 288,300. Lung cancer has 238,000 cases. Large intestinal colorectal cancer had 153,000 cases. Melanoma, which is cancer of the skin, very aggressive, had 97,000 cases. And urinary bladder cancer had 82,000 cases. Now, even though breast and prostate cancer are a bit more prevalent, there are more cases, lung cancer have more deaths. Okay, and I'll explain later why that's the case. So we have basically from the 238,000 cases diagnosed in 2023, at the same year, there were lung cancer cases of which 127,000 were patient passed away. In colorectal is 52,000, pancreatic cancer 50,000, breast cancer 43,000, prostate cancer we have 34,000, and liver cancer and also gallbladder biliary type of cancer 29,000. Both sexes, people died at that year of these different type of cancers. So the American Cancer Society estimates that for lung cancer in the US for 2023 are about 238,000 new cases of lung cancer, of which 117,000 are men and 120,000 are women, just slightly more women. About 127,000 deaths, as we mentioned before, from lung cancer. About 67,000 were men, about 59,000 were women. Men died more, had a higher rate of death than women. Lung cancer is by far the leading cause of cancer death in the United States, accounting for about 1 in 5 of all cancer deaths. Each year, more people die of lung cancer than of colon, breast, and prostate cancer combined. On a positive note, the number of new lung cancer cases continue to decrease, as well as the number of deaths from lung cancer. This is primarily due to reduction in risk factors. So early detection with low dose lung screening and advancements in lung cancer treatment. So basically, there are less new cases because of the risk factors. We're trying to work on the risk factors, and there are less deaths because the treatment becoming more effective. So what is a risk factor that we keep talking about? A risk factor is anything that can increase or decrease a person's chance of getting a disease or illness, in this case, cancer. So for lung cancer, the risk factors, the number one, obviously, is smoking. It's a leading risk factor for lung cancer. 85 to 90% of lung cancer cases are smoke-related, either direct or secondhand. Smoking rate in the US is 15%, despite efforts to increase awareness. And tobacco, cigar, hookah, pipe smoking, anything that's a chemical that you inhale, even marijuana, can increase lung cancer risks down the road. So when you really look at the history, you can see how smoking was introduced during the war, and they used to give cigarettes to the soldiers. And so cigarette smoking increased significantly, and you can follow the graph a few years later, and you see how the increase of lung cancer cases, jumped directly related to all that smoking that was done by the soldiers and then in society as a whole afterwards. Secondhand smoke exposure causes an estimated 3% of all lung cancer deaths each year, which is equivalent to about 3,600 deaths in 2023. So people think that just because they're not smoking, they're not at risk. But if someone is at home smokes, or they work in an environment where people are smoking around them, that will have an impact. Have your family member who smoke quit for not only themselves, but also for the loved ones. Lung cancer risk factors. So exposure to cancer-causing agents such as inhalation of chemicals and toxic elements can be a risk factor. Asbestos, which has been, most people have heard about it. They're basically fibrous minerals used in fiber-proofing materials, insulation, automotive parts, etc. Arsenic, it's an element found in rocks, soil, water, and pressure-treated wood. That's less common. Radon is a type of radioactive gas that results from the breakdown of uranium in the soil and rocks. That's rare too. Radiation to the chest from previous radiation treatments. If a patient had a history of breast cancer and had radiation to that breast area, some of the chest was exposed, can increase the risk of lung cancer. Numerous x-rays or CAT scans, if patients have had at a very young age, a lot of CAT scans or x-ray, that can certainly increase the risk of lung cancer. It doesn't mean that you shouldn't get your scans done, but, just be mindful that, in some cases where patients who have a lot of scans, that may have an impact. Air pollution, diesel exhaust, or heavily trafficked roads and cities certainly can have an impact on your health. And last but not least, personal or family history of lung cancer. If lung cancer runs in the family, that could be, increase your risk factor. Or if you have a history of lung cancer, increase the risk developing a second lung cancer. What can you do to prevent lung cancer? Well, there is no sure way to prevent lung cancer, but there are certain things that obviously we can do to try to decrease the chances. Okay? Let's talk about preventing lung cancer. Reduce or eliminate exposure to known cancer-causing elements, chemicals, pollution, and radiation. So, unfortunately, you become what you eat, you become what you smoke, your body is a river. You've heard all these expressions. You take care of yourself, you careful what, where you live. All these things do matter. Where you work, all these things matter. You hear the story of the people who work in the restaurant industry or at a bar all their lives. They own a restaurant, a bar, and they were exposed to smoking. That can have an impact on you for years later. Exercise regularly and follow a healthy diet. Okay, it makes sense, but it takes a lot of effort, and people do it at the beginning of the year and then they forget. So be physically active. So adults should get at least 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity of exercise each week. So you got to really put the time in. Teens should get an hour of moderate or vigorous intensity exercise daily. Moderate intensity includes walking, leisure, bicycling, yoga. Vigorous intensity includes jogging, running, weight training, tennis, where you really get your heart pumping. Follow a healthy diet, eating nutrients-dense foods, a variety of fruits and vegetables or grains. Very, very important. Very, very important. You've heard of the cancer-fighting foods, food with a lot of antioxidants. That's you're gonna find a lot in fruits. Limit or eliminate red or processed meats, sugar-sweetened beverages, highly processed foods, refined grain products. All these things can certainly take a toll on you years later. Lung cancer is curable when caught early. So this is a very powerful graph. I know it looks confusing, but if you really look at the top line, you can see there starts at 100%, and then it kind of like stays fairly close to 100%. That means that people who were caught with stage 1 lung cancer, which means it was only in the lung, small size, didn't spread anywhere else. It didn't spread to the lymph nodes, which are, we'll talk about lymph nodes later, but basically glands of the immune system that are all over the lung. The cancer can spread around that area, or it didn't spread to the bones or to the liver, just limited to the lung. With effective, appropriate, state-of-the-art treatment, you certainly will most likely be alive 5 years from now. Okay? Most patients are diagnosed with advanced disease, which is the patients we've been talking about. Here you can see stage 4. Those are the patients who have lesions in the in the liver that has spread to the liver or the bones. That's stage 4. So those, definitely are more prevalent. And that's the reason for lung cancer, most patients die fairly early because they're detected. When it's detected at an advanced stage 4 level. So lung cancer screening. Basically, we have now the technology to try to catch things early, just like we do colonoscopies and mammograms. With a low-dose CT scan could save your life. If you have a long history of smoking or you have certain risk factors, your doctor may be able to get it approved. You qualify for your CAT scan. And if the radiologist catches a very tiny lesion early, then you can fall on that part of the graph, which you stay, close to 100 chance of being alive, in 5 years. And after the 5-year mark, the chance of the cancer coming back decreases even more. So in accordance to the American Cancer Society, yearly screening with low-dose CT is recommended for people who are 50 to 80 years old, currently smoke or quit in the past 15 years, previously a smoker with a history of at least 20-pack year history. So, and the 20-pack year history is something that doctors calculate. So they try to figure out if you have, if you say you smoke a pack per day, okay, for a year, and you did that for 20 years, so that's a 20-pack year history, okay? Here you have 5-year relative survival for different cancers. This is from 2020, 2012 to 2018. So you can see some cancers, they're, when we find them, they're very, treatment is very effective. They don't, they're caught early, and that's where you see the thyroid cancer, for example, and testicular cancer. Prostate cancer now with the screening, we do detect a lot of patients early, but at the same time, even if we don't detect them early, usually with treatments available, we can prolong their lives for quite some time. Melanoma, if it's detected early, again, the same thing. You can see the survival is pretty good, almost 100%. For breast cancer, treatments are becoming more and more effective, and screening, mammogram screening is very prevalent. So again, you can see how high that number is. Same thing for lymphomas. Uterine cancer, also 81%. It's pretty good. Kidney cancer, still relatively good. It's not a fast-growing cancer, so that's the reason at 5 years, usually people are still alive. But, as you can see, still they do pretty well. Bladder cancer, about the same. Lymphomas, again, in the 70s. That's all pretty good. Head and neck cancer, oral cavity and pharynx, that's what we call throat cancers and oral tongue cancers, that's 68%. Cervical is 67%. Colorectal, 65%. So all these different cancers, they all have their treatments available. What moves this number has to do when they're actually in combined, when is it that they're discovered, whether it was more advanced, and how effective the treatments are. Larynx cancer, that's the voice box cancer, that's 61%. Head and neck cancer. Myeloma is a type of blood tumor, that's 58%. Ovarian cancer, again, 50%, and that's, even though it's sensitive to treatment, a lot of patients, by the time it's discovered, is fairly advanced. Brain, nervous system, that's 33%. That's unfortunately a very hard to treat type of cancer. Fortunately, it's very rare. Stomach cancer, 33%. Lung cancer, so you can see 23% survival rate. That's pretty low. Again, for the same reason, by the time they're detected, they're very advanced. Esophageal cancer, we're talking about 21%. Same thing. It's detected. A lot of patients are advanced too. Liver cancer, 21%. Pancreatic cancer, 12%. So that's a very aggressive type of cancer, and also very advanced by the time it's discovered. So how is lung cancer treated? So treatment depends on the stage and the type of lung cancer. So when we talk about the stage, right, we have from stage 1 to stage 4. Stage 1 is very small, limited to the lung. Stage 4, it travels all the way to the brain or to the bones or to the liver, or both, or different organs, okay? So when it's just in the lung, all right, those patients, after we do all the testing and figure out that it's just in the lung, then if the surgeon feels they're fit for surgery, then we'd remove part of the lung. Depending on how advanced, they may have to remove more lung. Okay, radiation treatment is basically like an X-ray, but more powerful and for more days. Chemotherapy, that's something that we use sometimes for more advanced lung cancer, especially for stage 4. And that's, we use medicines that go in, either you take it by mouth. Most of them we do as an infusion, as a treatment through the vein. There are also targeted therapies. These are therapies that are very, very specific to certain proteins in the cancer cells, and some of them are oral therapies. That's cutting edge treatments available. And so lung cancer is usually treated with a combination of therapies. So doctors, we meet together, or we do, telephone conferences, and we discuss the case and see what's the best approach. So for the type of lung surgeries, these operations require general anesthesia. So you're, put to sleep, and they're, pretty serious, extensive surgeries. Sometimes the thoracic surgeon has to remove the whole lung, and that's usually needed if it's a lesion that's very central, closer to the pipes that connect to, to the lung at the center of the chest. Or it could be a lobectomy. The lungs is made up of 5 lobes, 3 on the right and 2 on the left. And in this type of surgery, they remove a whole lobe of the lung. So it's just a whole section of the lung. And that is fairly common with the non-small cell lung cancer we talked about at the beginning. It could be also a segment or wedge resection where they just remove part of the lung, not the whole lobe so it's within a lobe of a lung. They remove a part of it. Or it could be a sleeve resection. And the sleeve resection is when the tumor is actually in the bronchus, which is the pipe that connects the trachea to the lung. So you have the throat, then you have the trachea, which is the tube that connects the head down through the chest, and then you have these 2 little tubes that go out to the lungs. When the cancer happens in those tubes, they sometimes remove a section of it where the tumor is located. Okay, so before the surgery, sometimes we have to do chemotherapy. And the reason we do that is because we want to be able to create a situation where the surgeon can actually remove everything. So sometimes we do it with chemotherapy alone. It shrinks the tumor, and then the surgeon can go in and remove the mass. After the surgery, sometimes we do chemo. That's called adjuvant chemo. And sometimes it's done with radiation too. And that's to remove any cancer cells that may be left behind. Okay, so that's just to remove the little stuff that may be around that is not visible. And sometimes if the cancer we find that is fairly advanced and the surgeon knows that he cannot remove everything, then surgery is out of the question. Then we do chemotherapy with radiation. And when we combine both treatments together, then a lot of times we can kill all the cancer cells. Now, a lot of times we do the chemotherapy with the radiation and followed by immunotherapy, a biological treatment, and that's done over a course of about over a year. And that really helps the immune system fight any, remaining cancer cells around. Okay. And obviously, chemotherapy is used when the cancer has spread to other distal organs. At this point, it's called more palliative treatment. We're trying to prolong the life of the patient as much as possible. In some patients now, with the advent of immunotherapy, we can put them on kind of a stable situation for many, many years. In terms of radiation therapy for lung cancer, there are 2 types of radiation available. There is what we call external beam radiation therapy. That's kind of like a bit more similar to like a regular X-ray. So you have a field of radiation going to a part of the body, okay? Fairly large part. And that's given daily over, many weeks, 5 to 7 weeks, okay? So this type of radiation most often is used to treat non-small cell lung cancer, or if it's spread to other organs. So sometimes if it's a painful lesion in the bone, they use radiation. Treatment is much like getting an X-ray, as I mentioned, but as the radiation dose is stronger. The procedure itself is painless, and each treatment lasts about a few minutes. Then there is also what we call SBRT, or stereotactic body radiation therapy, also known as stereotactic ablative radiotherapy. And this is a more focused, precise type of therapy. It kind of spares the lung around it. It's just a very small focus of radiation. And that's due for patients who have early lung cancers. And it's usually for a few sessions. It's more powerful radiation. And also it can be used for patients who have just spots that, distant organs, they have metastases where the cancer has spread to other organs. but it's just very few lesions, few spots, few masses that can be irradiated to. Immunotherapy for lung cancer. So this is the latest modality or treatment available now for lung cancer. It's been now for a few years, and it's revolutionizing how we do. We look at cancer, and it has a lot of indications, not just for lung cancer. And basically, what it is a treatment that helps the immune system be more effective in the fight against cancer cells. Okay. So immunotherapy is a treatment that uses certain parts of the person's immune system to fight diseases such as cancer. Immunotherapy uses the natural defenses of your immune system, so it works harder and smarter to find and attack cancer cells. In the last few decades, immunotherapy has become an important part of treating lung cancer. And immunotherapy works better for some type of cancer than others. And it's used by itself for some of these cancer, but sometimes it's combined with chemotherapy, the more traditional treatment. Okay. So please join us on Freedom from Smoking. There is no better day than the present to free yourself from the habit of smoking. If you call this number at Lipman Cancer Center, you can give it to a friend or to a relative to really make an effort and not give up. May not be able the first time or the second time, but the idea is to keep trying and find different modalities. Through the years, I have given a talk, a smoking cessation talk, and there are different things that need to be addressed, and it's not something that the patient should take on their own hands. They should really try to discuss it with their physician, because you'll be surprised that what they'll find out, and all the different things available to try to get them to stop smoking. Not only will it decrease the risk of lung cancer, but a lot of other cancers, risk of coronary artery disease, heart attack, stroke. Okay, early lung cancer action program. For this, you can reach the navigators at the Lipman Cancer Center in Cornwall, and they will walk you through it. And that will help you figure out if you can get more information in terms of whether you qualify for lung cancer screening, especially if you don't have a physician. If you have a physician, just make an appointment and discuss it with your doctor. That'll be the easiest.